I'm not Managar.
Some of the doctors are busy, might join a meeting.
Okay.
Yeah.
Good
Can
morning.
I just go over introduction? So, everyone, good morning. So this is Dr. Dilip Liyanage. He is the secretary to the Private Health Services Regulatory Council, and he is here to speak to us about the latent and the latent and active medication errors, right? This is a very, I would say, very important topic at this time when we have an issue at hand. So, I'm thankful to you for taking up the invitation in giving us this lecture. And I know how well he's prepared, and he has taken a lot of his free time preparing the slides and giving us this lecture. I hope everyone benefits from it. This is important for our own survival, each individual survival, right? Where our license can be at stake with all these errors that we can or we might get caught. Okay, so over to you.
Thank you very much for kind introduction. So without further delay, right, I would start. So we are in the corporate sector, right? So this corporate sector is, so we can use the word, this is a VUCA word, right? Do you know what is the meaning of VUCA? Okay. මේක ලියන්න මොකක් හරි එකක් තියෙනවද? So this is you call in VUCA word, right? V-U-Z-A. Anyone knows VUCA? What is VUCA stand for? Right? This is V for volatile, U for uncertain, right? C is complex, and A for the ambiguity. Okay, so we are in a very VUCA world, right? Especially මයක මේ ඔක්කොම ඉංග්‍රීසි සිංහලෙන් කියනවා. Everybody can understand. Genuinely tell me. Otherwise, I will do it both languages. Right? So when it comes to corporate world, right? Now, ඔයගොල්ලන්ට ප්‍රශ්නයක් වුණාම, right? The first person appears here to against you, right? According to the porter's 5 courses, right? Is your competitor. ඔයගොල්ලෝගේ letter එක draft කරන්නත් වෙන hospital එකක medical director වෙන්න පුළුවන්. So this is the reality in the corporate world. right? I will give you a simple example. දෙන්නේ ගියාලු කැලේ. යනකොට බඩගිනි වෙච්ච කොටියෙක් ආවා. So then එක මිනිස්සෙක් ටක් ගාලා වාඩි වෙලා ලේස් එක ගැට ගන්න ගත්තා. යාළුවා ඇහුවලු ඇයි උඹ ලේස් එක ගැට ගන්නේ? He said, what do you think? යාළුවා ඇහුවලු උඹට කොටියට වඩා වේගයෙන් දුවන්න පුළුවන්. නෑ මට ඕන උඹට වඩා වේගයෙන්. Why is that? මොකද කොටිය දෙන්නම කණ්ඩ අවශ්‍යතාවයක් නැහැ. So this is the corporate world, right? Simply if I explain what is corporate world, this is the corporate world. So you have to understand who is your enemy, right? Right? Who is your enemy? So keeping that mind, I will start. So this is one of the most important thing. So though this is new terminology, this is very outdated one in the modern world, right? So even human errors, it is very new in Sri Lanka, but in UK it has been started in 2004, right? Still lot of our people don't know what is human errors even, right? So keeping that mind, මේක ඇත්තටම කියන්න තියෙනවා ඔක්කොම එක වගේ දෙයක් තමයි. So you will get sometimes confused. If you have any confusion, please anytime you can disturb, right? But please listen to this. These are very, very important terminologies. I am going to explain why. Because you people don't have the big picture. These things, right? That is why we tend to do some slips, laps, mistakes and further violations. But without knowing that we are doing that, right? ඒක තමයි වෙලා තියෙන්නේ, right? So please try to understand this. So why patient safety is important, right? Why patient safety is important, as I said, especially when it comes to the private sector. This is corporate world. So what if the other, your rival is always try to do better than you, right? Not like in the public sector, right? So you have to do better than the other one, right? That is the most important thing when it concerns the private sector. So major concern. Why? Because we are, as I explained, we are working in the VUCA world, right? So this is very complex and influenced by many factors. These are the factors, right? I am not going to read that. So these are the factors mainly affecting this, right? So because we are working in very complex and uncertain world, uncertain situation, right? So we all human beings, we tend to do harm, right? But what is our principle as healthcare workers? This one, do no harm, right? But we are doing 1,000 surgeries very nicely, right? But if something went wrong, what will happen? As I said, your competitor will start the Facebook campaign, not the particular person. Before he starts, your rival will start the Facebook campaign and everything and drafting the letter and asking to go for the legal advice. Maybe he will pay on behalf of him, right? So this is the real, right? So therefore, why we can't improve this? Still in Sri Lanka, right? Because we are living, especially being consultants, and being doctors, we are living with the ego, right? I would say we are not living in the ground, little above, right? That is the main thing, right? Especially when it comes to healthcare workers, they don't want to accept something because we think we know everything, right? Because of this reason, in our part of the world, if something will happen, the lower category people, they are afraid to come or complain or report it to the higher authority. Why? Kiyapu gamanma pai. But I was the head for the sir in my trust where I was trained, right? But they were appreciated when they reported something. If they not reported something, then the problem next year they will not get their contract, right? So this is what we have to do, right? We have to appreciate them. Meanwhile, we have to find out the root cause. So without finding the root cause, which I am going to explain, right? මොනවා හරි වැරද්දක් වෙන්න ඒකට හේතුව තමයි ඒ මනුස්සයාගේ ප්‍රශ්නයක්. මොනවා හරි ප්‍රශ්නයක් හින්දා තමයි මේ මනුස්සයා ඒක කරන්නේ. Right? I have 2 hours now. Right? So I had a minor staff person. He is very loyal to me. Right? And work is up to date. letter එකක් ගහන්න කිව්වොත් සමහර development officer කෙනෙක් කාට උට letter එක draft කරන්න පුළුවන්. But his attendance is very good. Right? So I asked, මොකද උඹට වෙලා තියෙන්නේ? නෑ සර් මොකුත් නෑ. ඊට පස්සේ ඊළඟ දවස් දෙකක් වෙනවා අයිත් එක. එක දවසක් හුත්තටම කුණු හරපෙන් බැනලා දොරත් දාලා මොනවද වෙලා තියෙන්නේ? නෑ මූ අඬන්න ගත්තා. ආයි මොකක්ද ප්‍රශ්නේ? නෑ සර් කියලා දැන් මූ ඇම්බරන්. Right? That time I was the medical superintendent at the LPT hospital. එපැත්තේ තේවතු තියෙනනේ. මූගේ wife තේදලු එකතු කරන්න යන lorry driver එක්ක having some affair. දැන් තේදලු එකතු කරන්න යන දවස තියෙනනේ. එදාට මූ හැටෙන්නේ නැහැ. Right? So you have to find out the root cause. So what I did, I called the company owner and asked to transfer the bugger to a පැත්තකට. So then only he starts to come. So don't try to blame. මම simple උදාහරණයක් කියන්නේ. Don't try to blame to your colleague because you have to look after them because they don't have anyone to look after, right? Always if something is going wrong repeatedly කවුරු හරි hospital එකේ වැඩ කරන වෙලාවට බොනවනම් ඌට බොන්න හේතුවක් තියෙනවා. Right? ආතල් එකට බොන්නේ නැහැ. Because he is having some issue. That is why knowing if you get caught job එක නැති වෙනවා කියලා දැන he is බොන්නේ because he is having some issue. So you have to find always the root cause. Without finding root cause, don't try to punish them. Right? Keep in that mind. So please start. If you don't have this culture, right? Reporting culture, just culture, that is another lecture, right? So please try to start this. Right? And how big this problem? We don't have data, unfortunately. Being the private health sector director, I am very ashamed about that. We don't have this data, right? So this is data from USA. So they have done a study. They don't have even recent past studies. So this shows, as human being, how much we tend to do errors, right? So all the adverse events, I will explain it in few minutes. They are preventable, right? But how much, even in UK as a percentage, this is as a percentage, we tend to do. And then, how big is this problem? You can understand, right? This is the 8th leading cause of death in 1997 in USA. It's still the same, right? 33.6 million admissions in all over the country because of some adverse event, right? Maybe readmission or something. And see how many deaths, right? And this is the most important thing. So this deaths attributes more than this road traffic accidents, breast cancers, and even the AIDS. Right? So then you can understand how big is this problem, right? How big? So we see only tip of the iceberg, right? You don't see the huge iceberg which is down, right? So then the total cost, see how much we are spending without knowing, without our knowledge, right? So this is only the cost, so monetary cost. But here opportunity cost, right? Everything we are not calculating, right? දැන් උදාහරණයක් විදියට මේ මිනිස්යාට වෙන කොස්ට් එක අපි කියමු හොස්පිටල් එකට ආවිල්ලා ප්‍රශ්නයක් වුණාම ගෙවන බිල විතරක් නෙවෙයි right what I mean opportunity cost එයා වැඩට යන්නේ නැති හින්දා එයාට වෙන පාඩුව එයාගේ bystanders ලාවිල්ලා ඉන්නවා bystanders ලා වැඩට යන්නේ නැතුව වෙන පාඩුව so we don't calculate those things right so without that we are telling this is the cost so this cost should be twice or thrice right please try to understand what is the huge cost right so for example they have done this study and they are telling this is slightly higher than the direct and indirect cost which they use to manage HIV and AIDS so you can see how big this problem but we don't have better understanding we don't care about these things so the most important thing we have to understand how big is this problem and then starts measures how to prevent this right so please have a look so this is the ultimate effect right this is very heart touching photo which I was able to find right so the life lost right due to medication errors it was 7,000 deaths in that year 7,000 right those are preventable deaths so 1 out of 131 OPD admissions, right? How huge this problem? And then inwards 1 out of 854. And this is the pathetic situation, right? For me, even that will be a patient, right? When my wife was pregnant at the first time, what she is telling, Dilip, right so I am telling pregnancy is a normal thing that is a physiological change right so you don't have too much concern but that is different for them right for you he is just a patient but for this poor girl see what is happening for lifelong problem so therefore please concern each and every patient please try to treat like your family member then you will have better experience you will get better here manase satuta right please try to do don't think everything let it kawa right tawa monetary wise don't think right I am going to tell don't think this is tawat mage pocket ekata gana kiyana එක හිතන්න එපා because this is a noble job right so why these things happening because of this problem as I said earlier VUCA work, we are working in very complex situations and very uncertain, right? So you can see these two pictures, how complex the situation. At any time, this can go wrong, right? I can remember that time I was a house officer, just tsunami day, evening we had to do a surgery, elective section. We could not able to intubate the patient, right? Patient died. So this is complex, right? You don't know at any time this can go wrong, right? So we were unable to intubate and we didn't think about the tracheostomy, right? So I will explain in the down. So just that is why when we concentrate only intubating and your mind don't work, right? So nobody thinks we don't have that time, that experience. Nobody thinks that you have to do a tracheostomy. Simple tracheostomy would have saved the lady. So see this picture. So this is the reality, right? Why the importance of patient safety? Because we want to prevent the adverse outcomes. You can say I have saved the life, right? I was SHO GNOPS for a long time. I always tell to my wife, if I go, I will go at my earliest. I can deliver the baby, but then baby will be a CP baby. So that is better to baby to die, right? Rather than giving a CP baby to a mother, they will suffer for lifelong, and the other children also suffering. So the same thing. So this is the importance of having safety culture to prevent and reduce the adverse events. So see this picture, right? So we can save the patient, but without a leg, right? Amputated father. So this lady in our culture will be bullied by the others. Right? So this is the world, right? How those things will badly affect to them. So please think twice, because as I said, there are two noble jobs what I understand. Those are, one is the medical profession, the other is the teaching, right? So we are doing a noble job. So please try to do the justice to this job, right? Can you remember this incident? Anyone? I think Prof. Can. This is 2013 law student, right? What has happened? Anyone knows this history? That time I am starting my MD, right? So this was, she was complaining, right, because of the compartment syndrome. Early night, around 8 o'clock, she started to tell him, I am having a severe pain. But no attention, nothing, right? Where she can understand, could not understand by our healthcare workers. Why? Because අපිට එහෙම හිතක් නෑ. මොකද අපේ ලිරික් නෙවෙයි. දැන් මේක අපේ ලෙඩා කියලා හිතුවනම් අප්පා ගොඩක් දේවල් කියලා රෑ කන්සල්ටන්ට් නැකිටවලා කන්සල්ටන්ට් ගෙන්නනවා. Right? So why don't you think, why can't you simply attend? Consultant call කරන්න බය නම් simply මේක කට් එකක් දාන්න දුන්නා ඊට පස්සේ දවසේ උදේ වෙනකම්. Right? So simply you would have saved the hand. Right? So history is repeated. Right? So please see this. After really 10 years time, so this has happened. Do you know this one? This is in Jaffna Hospital. Right? After really 10 years, see how beautiful girl. And she was admitted to one of the private hospital, because I know one of the dermatologists, she was treating, and because she is having bad skin infection, her husband is a pediatrician, asked husband to take over, and husband tell, so we can't treat this patient at the private hospital, to admit to the, because I was the provincial director Jaffna earlier, and she called me to get some opinion, right? That is why I know the history very well, and admitted to the Jaffna teaching hospital on Saturday, and they start IV drugs. There was no problem. He did the board round, and Sunday also he did the board round, and night start the problem. And during the cannulation, nurse has, according to them, they are telling, nurse was doing the cannulation like this. Okay, nurse was doing the cannulation like this. So that is why circular has issued not to use phones during working hours. Right? So this is pretty bad. Maybe she can do that, but I will explain what will happen at the last, right? So she thinks she is very competent, even using the phone to cannulate. So this can't happen. Maybe we don't know whether, still we don't know the diagnosis, whether it is artery or something else. But the problem starts, they start to complain around 6 o'clock. She is having pain, severe pain, severe pain, severe pain, and she is crying like nothing. Right? Even I had a meniscus repair really 1 month back. I was having real severe pain around 11 o'clock, right, midnight. So I called and I asked all the type of IV antibiotics, right? Not IV antibiotics, painkillers, right? So as I am the director and I was the regional director Colombo, I was able to get down a nursing officer and I got injection, right? Otherwise I would not be able to sleep, right? Why don't you treat like this small girl, right? See how beautiful, right? And when she is complaining, nobody attacked. Even they didn't call to the particular on-call doctor. So this is the real pathetic thing, right? The consultant is very innocent, very genuine, very devoted, right? I would say 80% of the consultants in Northern Province very devoted. Majority they are not doing private practice, right? Majority they are not doing, right? There are 2 consultants, cardiologists, they are doing only 1 day private practice. There is no queue for even the cardiac surgery. They are very devoted, right? That I am saying because I was there for a long time. So this has happened. So this is what I am telling. The history is repeating. Why the same incidents, right? We have not learned lessons from the past. So I would say the same thing can be happen in our institution, maybe after 5 years. But why these things happen? Because we don't have rehearsals, right? We think in the corporate world it is money. No. If you spend for this, your income will be double or triple, right? So you know, after this incident in KT, right, case, so some hospitals now they can't function, right? Because as I said, corporate world, other people are attacking them. So please look at this. This is not myself, this is WHO says in 2014 in their article, 1 in 10 patients will be harmed during a hospital stay. So see how huge this problem. 1 in 10, right? This is not myself, this is by WHO, right? 1 in 10 patients harmed. This is true, right? So we don't see, but they have been harmed, right? So I had my pain for 1 month. Still I am on tel treatment and tellolimtamide. Still today I didn't go. So after that, because of side effects, because they have put the turning, and I was in lithotomy position for a long time, and the consultant is telling this is a very rare side effect, right? But I had 1 month severe pain. So we don't care this. Sometimes you don't get the feedback, right? And the golden question is, how can we improve this? So to improve this, with my experience, the most important thing is attitude, right? The most important thing is attitude. How you look at a patient. A patient or දැක්කහම දකින්නේ ඔයාගේ family එකේ කෙනෙක් විදියටද එහෙම නැත්නම් තවත් කෙනෙක් විදියට. I am not going to tell what. So don't please try to change your attitude, right? This is a noble profession and we have to do the social justice to who comes to you, because they are coming to you because they don't have any other way to get rid of their pain, right? That is why they are coming. They are helpless. So when the helpless people coming to you, we are trying to harass them sometimes, right? Don't do that, right? And please see this, then you will understand what is my whole lecture, what I am going to do. So just one and
Human error.
less than 2 minutes.
Human error is an ubiquitous and complex phenomenon that can occur in human industry or system. Understanding the different types of human errors is crucial for identifying potential risks and improving safety in high-risk industries. The second human and organizational performance principle is that to err is human, and error is normal. Recognizes that humans are not perfect and that making mistakes is an expected part of the human condition. Human errors can be divided into 2 main categories of interest to high-risk industries: active errors and latent errors. Active errors are immediate errors caused by individuals, while latent errors are organizational errors that can exist within the system for prolonged periods of time. Within active and latent errors, we can further classify errors into omission errors, where necessary action is not taken, and commission errors, where the incorrect action is taken. In this context, it is important to understand different examples of high-risk industries where these types of errors can occur to to learn from them, and to implement measures that mitigate the risk of human error.
So I hope you get the overview, big picture, what is this? So I will explain them here. So to understand this, you should know these terminologies, right? This is all about what is going wrong, right? So all errors, what is error, right? It is failure of planned action, right? Error means failure of planned action of කරන්න plan කරන්න එක. එහෙම නැත්නම් කරන්න කියලා හිතාගෙන වෙන දෙයක් කරන එක, right? Or use of wrong plan, right? So please try to understand this very well. So what is error? And then what is adverse events? There are two types. අපිට සමහර ඒවා නවත්තන්න බෑ, right? We can't stop. Preventable and non-preventable. Non-preventable, that is එක කරන්න දෙයක් නැහැ, that is your luck, right? So you can't prevent it, right? But there are preventable adverse events, right? The most important thing under this, negligence, right? So what is negligence? Anybody knows what is negligence? The explanation. So negligence is below your professional standards, right? You should know this, right, by heart. Those are the basics. If you don't know your basics of your profession, so you are not suitable for that job. So that is why you call it is negligence. That is why take actions against you when you conduct any negligence, right? And the other things, the most important thing, what in our country, now recently also I suggested to the FHB, better we have to start near misses to be studied, right, rather than doing postmortems. Because if you do a near miss, the person is there, you can get first-hand evidence. When we are doing postmortems, we are getting second-hand, third-hand, and right some false information. But the most important thing to improve a system is a near miss. What is a near miss? Right? You caught the issue before something goes wrong. For example, this poor girl, if they would have called to the consultant particular, if they would have called to a SHO, simple 1 second thing, no, just to remove the cannula, right, and then keep on observation. So they didn't do, they failed. Even don't ask, right? If you want to do something for the justice of the patient, right, do it. That is ethical, right? Nobody can blame you, even blame that you have done the correct thing, right? Don't ask. Sometimes in our country, the most important thing, especially in the government sector, the people, they are afraid to call to consultants, right? Especially if the dawasaka all korat ahaganna thamai wenne, right? So this is the thing what we have to change. Now sometimes when I am going to a private hospitals, some my friends, colleagues or senior consultants asking, Dilip, what you are doing here? Mama ahanna ona ප්‍රශ්නේ මගෙන්, right? මේ 12ට විතර ගියාම 11ට විතර ගියාම they are asking, Dilip, why you are here, right? I should ask the question, why you are here, right, during working hours. My job to go there, right? So this is the thing, right, in our country. So that has become the normal. So if we try to change this, so they think we are going to do something wrong, right? And this is negligence, right, below the professional standards. So it has been noticed. So this is wet flow, right? If you are not cautious, so this thing happen, right? So simple, you are not using your common sense even. And then the main topic what we are going to do today, what I am going to explain is this: active and the latent errors. So active errors, those are the most important thing. We have to understand very well human factors. So without knowing the human factor, that is a total different thing, different lecture, different topic, right? So active errors, that is the human errors which happens at the interface with the patient and the clinician. So very narrow gap, right? If something has done. Very difficult to revert it back, right? And the latent errors, those are the problems with the system, the managerial level, right? There are no protocols, there are no guidelines, no training, there is no supervision, right? So there is no way to checks and balances to check what has happened to stop this, right? So therefore, the most important thing, these two should go hand in hand parallel. මේ දෙකම parallelly සිද්ධ වෙන්න ඕනේ. right? කාට හරි සිංහලෙන් කියන්න ඕන නම් කියන්න මම සිංහලෙන් විස්තර කරන්නම්. And as I said, latent errors are the gaps in hire or the managerial level. If something has happened, right? You are the director. No. Director, you can't say I don't know, right? Even I am responsible. That is you call vicarious responsibility, right? So whatever now when I was the MS deputy director acting at Mulleriya, one day when I went early morning, I am normally go from the back side of the hospital and මිනිස්සු ගොඩක් ඇවිල්ලා ඉස්සරහා ඉස්පිරිතාලේ වට කරන්න හදනවා. Why? ලෙඩෙක් මැරලා. දැන් මේ බොඩි එක ගේන්න හදනවලු ඉස්පිරිතාලේ ඉස්සරහා. Right? So you are responsible. Even I don't know what has happened and when it has happened. Right? So but you are responsible. Right? Your responsibility. ලෙඩෙක් මැරුණාම මේක surgeon ගේ වැරද්දක් කියලා කවුරුවත් ඇවිල්ලා කියන්නේ නැහැ. That is the problem with the managers. Managerial level issue. So that is why it's important to know the system errors. Right? So system errors, we are the responsible people, right? The managers. And if something happened at the patient level, that is the problem with the clinicians or the healthcare workers. But we all responsible for this. කාටවත් කියන්න බෑ නෑ නෑ managers ලා මේක කරපු නැති ඉන්න තමයි මේක උනේ. මේක ඕගොල්ලෝගේ වරද. So you can't say. This is, we all responsible. This is a teamwork. Right? So latent errors, why these latent errors occur, right? Because the first thing is heavy workload, right? As I said earlier, because we are working in a corporate world, අපි බලන්නේ අඩු ප්‍රමාණයකින් වැඩි ප්‍රමාණයක් ගන්න. But that is not happening in the foreign countries, right? So where I did my foreign training, the hospital bed capacity is 5,575, middle level district general hospital. The staff, you know how much? Around 5,500. I was thinking, why this much? Because they have done experiments, right, to reduce this. So we take one medical officer, and he has to work in the ETU, he has to look after the OPD, and sometimes full day, night, whole hospital. You can't do, right? They have to be mentally free to do his job. Sometimes you put a doctor for 24 hours to work. So that will never happen in foreign countries, right? They can't do, a normal human being can't do that. They can't concentrate. That is why these things happen, right? And then the unwritten policies, that is the most important thing, right? So when I discuss this, you don't have double check mechanism. If you have double check mechanism, right, simple, you can avoid a lot of things. So therefore, for each and everything, so we have to have policies, protocols, SOPs, guidelines. So which is not at all, right? At least whatever the things, how to maintain a BHT, you don't know, not practicing, right? Simply, as per the newest guideline in the ministry, you have to abide by the guidelines issued by the Ministry of Health. So no one, even the private sector, no consultant is putting, no doctor is putting the date, time and a small signature. Why I am telling this, even a small signature, මේ දවස්වල නඩුවක් යනවා. ඒ නඩුවේදී අහනවා. How do you prove? මේ consultant බැලුවා කියලා. No way, no signature, no handwriting. That is why අපි ministry එකේ ඊයේ වගේ ගැහුවා වෙන doctor කෙනෙක් hey you have staff no why your diary can't be written by other one, right? My staff person. I said no, diary should be written by yourself, your handwriting, right? So that is why, so my humble request, please tell all the consultants now why other countries they are not doing the that ඔක්කොම වෙන රටවල් වලට ගියාම වැඩ කරන්නේ අපේ රටවල් වල දොස්තරලානේ. Why? Because they are not doing that because of the court cases, right? Now the trend has come here, right? Initially I had a thought to do law after my MD, right? So then I am a very good person if I go to the courts, right? I know that now a lot of people will do, right? So because this is a very good way source of income, right? So there will be a lot of cases. So therefore, please, if you don't have policies, please do this, right? Especially there are some things we have tell. If it is allergy, you have to write in red, right? Even these simple things, please try to adhere, which is not practicing, right? My humble request, because we want to improve this, we want to develop this, right? And then the most important thing is training. Training. That is the most important thing, which you don't have to spend money, right? Even if you ask doctors, they will come and do freely, right? So please try to do training and then the supervision. Most important thing is when you do the supervision, what do you think? Why we do supervision? What is the importance of doing supervision? Why do we have to do supervision?
Prevent the incidents.
There are 3 D's, right? When you are doing supervision, you have to find 3 D's. That is first D is defects. The second D is deviations. The third D is deficiencies, right? Defects, deviations, and deficiencies. Udaharana, if I do water out, right? I can understand. දොස්තරලා කී දෙනෙක් උදේම ඇවිල්ලා water out කරලා තියෙනවා. If I do further, dengue hari suspected case එක කීයක් notify කරලා තියෙනවා. So those are the routine things, right? But you are not doing. So if you are not doing for a long time, that become a norm. So that is why you want to do the supervision. අපි supervision කරන්නේ මොකටද? අපේ රටේ තියෙන idea එක supervision වෙන මූ ඇවිල්ලා තියෙන්නේ අපේ වැරදි බලන්න. No. That is wrong culture, right? So supervision is just for fact finding, not for fault finding. Don't do fault finding when you are doing the supervision. So the whole purpose is fact finding and take these 3 D's into the correct way, right? මොනවා හරි deviations තියෙනවා නම් put it to the correct way. Any deficiencies, put it to correct way, right? Any defects, make it back, right? Don't let to derail. So please try to understand, that is the most important thing, the training and supervision. Please try to do as much as possible. People දෙනෙක් අල්ලගෙන training කරා, which is not happening in our country, right? Then the maintenance care එකක් ඇත්තෙම නැහැ අපේ රටේ, especially in the public sector. I don't know in private sector, right? So please have good maintenance. හැම එකකටම logbook එකක් තියාගන්න, right? So please try to do, right? මම හිතන්නේ දැන් සමහර surgeries you people can in the corporate sector you can pool it, right? So when I went to Japan in one hospital which is the big hospital, they don't have the අපේ hospital එකේ හැම එකේම තියෙන ultrasound scan එකක් නම් VOG ට ලියලා දීලා තියෙනවා. ඒක හොලවන්න. But that is not happening in the developed countries, right? They have a scan pool. Some nursing officer has to go. Everyone working in the foreign countries, they have a card. You have to sweep the card, you can take it, right? And then after you scan, you have to keep it, right? So there is 28 floors, 2 buildings. So they have around 7-8 scan machines. But here, BOG ke kallanna bෑ, right? SHO ke kallanna bෑ, right? ඒක තව වෝඩ් එකකට දෙන්නෙත් නෑ. So this you can't run in long way, right? මොකද ඒ බඩු පාවිච්චි වෙන. දැන් අරකෙදි වෙන්නේ වැදගත්ම දේ. You can use it for 5 years and then discard. මේකේ කරන්නේ මොකද්ද? When I was working in Jayawardhanapura, that time it was 138 million rupees scanner, right? මම යනකොට අවුරුදු 3ක් වෙනවා. ස්කෑන් 50කට වැඩි කරලා තියෙනවා. because ඒක හොලවන්න බෑ. ඒක පුළුවන් අර කන්සල්ටන්ට් විතරයි. So this is thing, right? Don't do these things, right? Money is කාගේ වුණා private sector වුණා, that is money, right? So then the most important thing is communication. Communication gap. Have you ever heard whistleblowing කියන එක? Right? That is not happening in Sri Lanka and not allowed. So there are a lot of whistleblowers in other countries. That is why world is developing, right? Janitor ට පුළුවන් ඇවිල්ලා මේ වගේ meeting එකක sir මේක මෙහෙම කරොත් හොඳයි. That is his experience, right? We have to respect it. What is the most important in our country? We don't have respect on each other. කාගේ හරි මතයකට ගරු කරන්න. කවුරු හරි නර්සින් ඔෆිසර් කෙනෙක් කිව්වනම් මේක මීට වඩා හොඳයි. So මගේ experience. So you have to listen, right? Then you can pilot it, right? No audits happening in our country, right? So that is the most thing, right? Audits කරන්නේ මේ වැරදි බලන්න නෙවෙයි. අපි හිතන්නේ auditor කෙනෙක් ආවම ආරයි ප්‍රශ්නේ. But this is clinical audits, right? So please try to inculcate this culture. Otherwise, definitely you are harming yourself. And then, as I said, what is this human error? Human error is the most important, and you have to be very, very careful, especially in private sector, right? Now, day before yesterday, I have to handle a simple matter. Sutures දෙකක් දාලා රුපියල් 6000ක්, right? Sutures දෙක රුපියල් 6000යි, tetanus toxin එකට 1130යි, right? This has happened to one of the very big person in the Sri Lanka army, and he called me, he complained me then and there, right? So everything you get complaints, right? It will go to definitely then the president, right? Then they are coming up. You have to have immediate price regulation, right? This is the simple thing. So therefore, so frontline workers, you have to be very, very careful, right? Because you are working in a very fragile interface. මොනවා හරි ඔයගොල්ලෝ කරන දෙයක් just miss වුණොත් you can't take it back, right? දකුණු කකුල ඔපරේට් කරන්න ඕන. නමුත් මාක් කරලා නැහැ, මොකුත් නැහැ, වම් කකුල you did the correct thing. Right? Because communication gap, lot of things, right? So between patient and healthcare worker, that is not between doctor and the patient, right? Please try to understand that this is a teamwork. We all responsible whatever the things we are doing. නෑ මම දන්නේ doctor තමයි දකුණු කකුල කැපුවේ මම දන්නේ නෙවෙයි කියන්න බෑ, right? This is a teamwork, right? And what will happen if we fail to do these things, right? Active and the latent. So this will happen. Multiple latent errors. What will happen? Multiple latent failures align to allow serious human errors. So that has happened. That is what has happened here, right? Because you don't have the good mesh to prevent active errors. You don't have a very good established system at the system level. So multiple latent errors and serious human errors has occurred, right? These things very old, right? Theories, right? 2015. This is first published, right? And this is the thing. This is what I have explained it as a snapshot, right? This is the arrow. So you can see here the system errors, and this is very sharpened active errors. So you can see very narrow. Margin is very narrow, but the harm is fatal, right? So therefore, what is this active errors? So these are the things. There are government policies and things you don't adapt, you don't care, right? Api private sector apita eva. Why these things has come? Because with the experience, right, to prevent and to deliver better service to the common public. Namuth apita adala naha, private ne apita, right? Then there are regulations. You neglect the regulations, and then hospital there are policies and things. Api consultant, api ko adala ne, bola api ka karana, right? So that is the mentality. I am very sorry to say that. So that is the mentality. But if something goes wrong, there is no one, right? So therefore, we have to protect ourselves, right? We have to adhere to these rules and regulations. Why? Because of the evidence. Evidence says if you deviate from these things, you will be definitely end up with some problem, which ituru enne samanlata wife vitara, right? Hari spouse vitara, wena kawuruවත් නැහැ. Right? ඔක්කොම කට්ටිය අත පිහිට ගන්න බලයි. So therefore, please try to understand this. And then the management issues, there are no protocols, there are no guidelines, there are no SOPs. And then the operational level staff, they have not been trained, right? They have not been trained, they have not been supervised. So that has happened, right? Maybe not trained, and then a procedure එක කරන වෙලාවේ not supervised by a senior person, right? These are very simple things, but trend to serious errors. And then the active, I will explain what are those things and how to stop them. To explain this system errors, there was a professor in UK, Professor James, right? He has developed and he got the Nobel Prize for that. Anyone knows what is that? Swiss cheese model. Have you ever heard? Right? Swiss cheese model. This is the Swiss cheese model, right? Reasons model, you call reasons model, you call Swiss cheese model, right? Professor James Reason, in 1990, he developed this, right? This shows how these things will happen. So this is like a cheese. So you have seen in some cheese there are holes, right? Very expensive cheese, there are some holes, right? So like this, these are the defensive mechanisms. There are several defensive mechanisms. But overlapping happens when you don't have a developed system, right? දැන් ඔයාට hospital එකේ protocol එකක් තියුණා නම් I will take the same example. Before giving any IV drugs, right? You have to call. දැන් උදාහරණ foreign countries වල if you have to give a IV drug, if there is no signature by the prescribing consultant, they don't give. They will call to the particular consultant and recheck. Sir, may drug එක දෙන්න කිව්වා. So beforehand, you have to ask, this should be mantra, right? I don't know, for me, if any person come, I ask, what any allergy, right? Any customer irkida, right? You have to ask, that should be your mantra, right? Some people ask only drug allergies, don't ask only that. Mokada may be precipitated by food allergies, right? දන්නේ අන්තිමට මේක ඇලර්ජි වෙලා තියෙන්නේ බෙහෙත් එකටද ගත්ත කෑම එකටද, right? So therefore always use to ask whether you have any allergy. Then the protocols, if the may protocol එකක් තියුණා නම් doctor can confirm කරගන්න, especially right in private sector, right? Allergy එක බලලා protocol එක බලලා, right? Then the second incident වේරාදනීය වෙච්ච, right? You have to give IV especially. Junior nurse කෙනෙක් බලන්න ඕනේ. It should be double check. There should be checklist, right? Simply tick. වෙන මොකුත් ඕනේ නැහැ. Tick එකක්, right? Junior nurse බැලුවා, senior nurse බැලුවා, වෙලාව පොඩි signature එකක්. Develop that. So double check mechanism. So these things can be prevented. These are low cost, no cost mechanisms, right? You don't have to spend much. එහෙම ගොඩක් සල්ලි යනවා නම් take a like a laptop or something, the tab, you can ලෙඩාගේ නම හැම ලෙඩාගාටම වාට්ටුවකට කීපයක් තියාගන්න admission එකේ. Just check it, right? Please try to adhere. So that make a protocol එක තියුණා නම්, right? Information හරියට දීලා තියුණා නම් මේ දෙක align වෙනවා. So this will defense. right? මේ arrow එකට යන්න විදියක් නැහැ. So there will be no harm. I hope you understood this, right? So that is why to any procedure you have to develop series of defensive mechanisms, right? If you don't have, please try to discuss, especially major things, sometimes minor which can be a major, right? So therefore, please try to have better understanding on this. There are a lot of reading material available, so please read. So these things, then, so decision should be taken by, especially this, by consultant or a doctor, and he should discuss. And even you don't have a system to develop before giving the particular drug, especially if it is IV. So ask simply, what allergy එකක් තියෙනවා, right? And there are no visual materials, right? That is the most important thing. Why I can't even understand, right? Kanban systems, that is you call, right? There is no visual materials. Simply, අතට බෑන්ඩ් එකක් දාලා තියුණා නම් anybody knows මෙයාට මොන හරි ප්‍රශ්නයක් තියෙනවා අහන්න, right? Even as I said, as I suggest, BHT එක වෙන පාටකින් තියුණා නම්, right? ඔක්කොම කොළ පාට, allergy තියෙන එක්කෙනාගේ දැන් රතු පාට දාලා තියෙනෝනේ, රතු පාට එක. Definitely you try to ask. So develop some kind of mechanism. So those are low cost, no cost, right? එකපාරක් හැදුවම අවුරුදු 5ක් පාවිච්චි කරන්න පුළුවන්. So please develop this. So this will save a lot of money, the stress, especially අනිත් ඒවා කෙසේ වෙනද, right? So therefore, please try to understand this Riskies model. Anyone can remember this, right? Right? So this is happened in 2012. Like same incidents like Karata Kaputu, Vedasta. So why these things happen? Because of human errors, right? Because of these errors, why this happen? Anybody knows? This pahak make a right? Why? එයාට යන්න route එකක් දීලා තියෙනවා. He has deviated from the route. So you can't do that. Because these are experimental things. යන්න ඕන පාර හරියටම දීලා තියෙනවා. Without getting any instruction, he has deviated and hit with the rock. Right? So this is simple example for the human errors. Why? Because not adhering to the given instruction. Right? හොදක් කරන්න තමයි ගිහිල්ලා තියෙන්නේ. ළඟින් ගිහිල්ලා වැඩි හොද පෙන්වන්න. Don't be වැඩි හොද, right? That will be end up your life, right? So lifelong imprisonment, right? And then anybody knows this? මේකේ 82ක් මරුණා. 147ක් they were injured, right? Anybody knows this incident? This was in 2000 July 2013 Spanish train crash. Why? I make a සිද්ධ වෙන්නේ? Please have a look. සද්ද නැහැ. මොකද මේක CCTV වලින් ගන්න තියෙන්නේ. Same thing repeating. Why this is? Because he went double the speed which has been given. A bend එකේ 80ට තමයි දීලා තියෙන්නේ, but he has double the speed. Don't know the reason, right? So this is what will happen if we violate the given instruction. Therefore, humble request. So if something laid down by the government, maybe by the institution, as employers, that is our duty, right? To protect the institution, to protect the people. So therefore, don't try to be too smart, right? If you have anything, just in the meeting discuss. I make it over the meet, but without discussing, don't try to change the laid down guidelines or protocols, right? Always let them to speak, right? So prepare, develop whistleblowers. So you will definitely develop, right? And this is what I explained, right? So this is like a huge iceberg, right? අර කකුල කපපු තාත්තගේ වගේ. දැන් තාත්තගේ කකුල කපලා තාත්තා ජීවත් වෙනවා. නමුත් the problem ඒ මනුස්සයාට වැඩ කරගන්න පුළුවන්. ඊට පස්සේ ළමයින්ට වෙන bullying, right? There is no cost, you can't estimate that, right? සමහරවිට ළමයා තාත්තත් එක්ක ඉස්කෝලේට යන්න බයයි, කැතයි. තාත්තගේ කකුල කපලා, right? So these are the things, please think twice, right? We see the tip of the iceberg, right? But we don't know how big this problem, which is invisible to majority of us. So therefore, please think big. Then only we will understand this problem. So this is a simple test because I am starting the main part. Right? This is the cognitive deviations. Have you ever known this test? This is a PhD for a thesis, one of the guy in 1934, right? His name is Stoop. That is why this test is called Stoop test, right? So please read this. Here how the Stoop test works. I will give you a word like this one, red, right? And you will say the color of the word, right? Color එකයි කියන්න ඕන. දැන් red නම් red කියන එක කියවන්න එපා. red කියන එක මම green වලින් ලියලා දුන්නොත් ඔයා කියන්නේ මොකද්ද? Green, right? So please get this. So you will understand how you can control your mind, right? So red, you have to read the color, right? Not the what we have written. And here, for example, you should say red when this word is shown in red. You can't say blue, right? Because this you have to read the color. And here you have to say pink, but you will definitely read this as green, right? So test will start, right? So this is the test. If you want, you can read, and if otherwise you can silently read, right? So see how fast you can do this. Red, blue, green, yellow, yellow, green, blue, red, right? And now please do it.
Green, yellow, red, blue, red, blue, red, yellow, blue, red, green.
So little difficult, no? But if you read red, blue, green, yellow, yellow, green, blue, that is more comfortable, right? So this is how our mind is behaved, right? So that is where without our knowledge these things will happen. So see, this test is how simple. This is very simple, right? අර කැනියුලා එක ගලවන්න තියුණා වගේ. අච්චර කෑ ගහනකොට මොලේ කල්පනා කරලා කැනියුලා එක ගැලෙවුවා නම් ළමයාගේ අත කපන්න වෙන්නේ නැහැ. Right? So this is simple task. But the problem is, as I said, we are working in a complex world, right? Very uncertain and very ambiguity, right? Set up in unfavorable way. අපි system එක හදලා නැහැ favorable විදියට. Right? ඒ මනුස්සයා සමහරවිට පැය 18ක් එක දිගට වැඩ කරනවා. Maybe working in a noisy environment. Maybe stress from the consultant, right? Right? So maybe family issue, right? So working in unfavorable way, right? So then be prone to errors, right? Simple test. So be prone to errors. Oh, please keep this in mind, and keeping this mind, I will explain what can be go wrong, right? Okay, human errors, simply we can classify it like this: errors and violations. If it is an error, that can be accepted, right? But don't try to do errors as it is accepted, right? Because we all humans, so we try to do errors. But violations, no, right? So errors you can divide it skill based and then the mistakes. And please try to have the definition of this. Errors you can broadly divide into omissions and the commissions. Right? What is omission? Failing to do the right thing. Failing to do the right thing. And then what is commission? Doing something wrong. Right? Doing something wrong. I will explain in few minutes what is these two. Right? And then again, errors, those are skill based, and mistakes as I explained. The mainly what is happening, these are the things normally happening without our knowledge. Those you call slips and the lapses. What is this slips and what is this lapses, and I will explain. And then mistakes, they are mainly rule violation and the other thing. So you don't have up-to-date knowledge sometimes, right? So therefore, that is why importance is the training. And the violations, දැන් මෙහෙමනේ අපිට වෙන්නේ වැරද්දක් වෙච්ච ගමන් නොදැනුවත්වම අයියෝ මෙහෙම වුණාද කියලාත් හිතෙනෝනේ. But without your knowledge you have done this. Right? එතකොට ওই පින්තූරේ තියෙන විදියට ඇස් දෙක ලොකු කරලා හරි අත ගෙනියලා කට ගාවට තියාගෙන ඉන්නලා වැඩක් නැහැ. Before that you have to do this, right? So violations, those are routine violations. අපි එහෙමත් කරනවානේ මවට මතකයි මම ඉන්ටර්න් කාලේ කෑ ගන්නකොට distilled water inject කරලා තියෙනවා, right? So it is very painful, right? And then the situational. Puncture එකක් ගියා මම තවත් හයියෙන් යනවා මොකද පරක් වෙලා වැඩට යන්න. Right? Situational violations. You don't have option, so you violate. Right? And then the exception. Right? So please, so these are very important and little boring. But please try to alert, and if you have any question you can ask, right? So what are these slips and lapses? So please try to understand, this will happen in familiar task. You have done this, right? This is nothing new, right? Nothing new. Right? So we think, right? We all human beings. Right? We think that is the normal nature of the human beings, right? So that is the normal human behavior. So why this is happening? Because this is unconsciously we are doing, right? අපිට නිකන් කාර් එකක් ඩ්‍රයිව් කරන්න උනාම සමහර දාට මට මතකයි කොපාරක් හොඳට බීලා හොඳට මතකයි කොහෙද ඩුගේ ගොඩාර පාලම උඩින් වැටුණා ඊට පස්සේ මතකයි ගෙදර ගිහිල්ලා නැවතුණා. Right? So driving, unconsciously you drive it, right? You think you can do that, but මට ඒ incident එක විතරයි මතක රෑ දුන්නට විතර. Right? After that now I never drive like that, right? So unconsciously, because you have confidence, and then what is happening, because you think you are very expert doing this, unconsciously you think your attention can be goes off for a minute. Maybe doing a very serious surgery. Wife kata karla kiyana right gedara enaකොට aran enna me ratu wala lunu meka naha, right? So wife ke call එක සමහරලාට answer නොකර බෑ. You have to answer, right? අනිත් මොනවට answer නොකරත් ඒ call එකට answer කරන්න ඕනේ. මොකද නැත්තම් ගෙදර ගිහිල්ලා බුම්ම ගෙනියන. Right? So that is happening. So you have to have principles, right? At any cost ගෙදරටත් කියලා තියෙන්න ඕනේ. If I start the surgery, so the hospital policy, you can't answer to the phones. So simply, no deviation, right? So because of these things, we are vulnerable, right? So as I said, this simply frequently perform actions, but can go slow. මොකද අපි හිතනවා right මේක ඔච්චර බලන්න දෙයක් නැහැ හැමදාම කරන දේ මම මේක කරලා පුරුදුයි. But simple deviation අපි දන්නේ නැතුව බබල් එකක් කැපිලා තියෙන්න පුළුවන්. Right? So therefore please be alert. Right? So this what is this slips? Or as I said earlier, commission. So what is this commission? Doing something wrong. Right? So මේකෙන් තමයි අපිට කියන්නේ අයියෝ මොකද දෙයක් වුණාද කියලා oops කියලා, right? So not doing what you are meant to do. අපි හිතන් ඉන්නේ මේක කරන්න නමුත් කරලා තියෙන්නේ වෙන දෙයක්. Right? Doing something wrong because these are මම කිව්වේ automatic task. කරලා ඒක නිකන් අපේ දැන් brain එකේ wired දේවල්. ඒකයි හිතන්න දෙයක් නෑ. just automatically වෙනවා, right? පළවෙනියෙන් slip එක දැම්මා ඊළඟට මේක ඉරුවා ඊළඟට මේක ගන්න තියෙන boom එක කපුවා ළමයා ගත්තා. So automatically you know what is the procedures, but that is not laid down, right? And not putting, so simply not putting mask before starting the surgery. ඒක අමතක වෙලා වෙන්න පුළුවන්, right? Not putting because you have එකක් කරලා ඉවරලා ඊළඟ එකට ගලවලා දැම්මා ඊළඟ එකේ මතක. right? නමුත් surgeon හින්දා අනිත් කට්ටිය කියන්න බෑ. Because there is no laid down procedures, right? ඒකේ තියුණා නම් without wearing a mask you can't start. So දෙයයන් වහන්සේ ආවත් mask එක නැත්නම් you can't start. So you have to have laid down policies. I am very sorry sir, without mask you can't do this. So please develop this, right? Anyone who comes to work here, they have to oblige to these policies, right? And operating left instead of right, right? Because there is no laid down policies to, there is no checks and balances, right? And for example further, why this is happening, wahane drive karno, you want to put the headlights, but අනිත් පැත්ත දාලා, right? Simply එහෙම වෙනෝනේ, especially if you go to foreign country and come, right? ඒකේ තියෙන්නේ light එක දාන්න තියෙන්නේ වම් පැත්තේ, ලංකාවට ආවිල්ලා දාන්න එක. Simply happening, right? Those who are driving there and those who are coming here, simply still happening sometimes. Unconsciously, මොකද ඒක මතක නැහැ හරියටම, right? So then move a switch up, අර වීඩියෝ එකේ තියුනේ. Moving a switch up rather than down. අපි හිතන්නේ හරි එක කරා කියලා, but wrong action. හරි එකේ තමයි කරලා තියෙන්නේ, but it is a wrong action. තරම් කදින්න පුළුවන්. Right? And then not putting mask before, I explained that. And then operating left instead of right. Right? Right action done on the wrong object. Right? හරියටම කරලා තියෙන කකුල ලස්සනටම කපලා තියෙනවා. Right? කපලා තියෙන්නේ වැරදි කකුල. ආගෙද වැරදිද? Team, right? You can't finger to the particular surgeon or the anesthetist, right? So therefore, please try to do this, right? And slips. Why this? What is the reason why this is happening? These slips. These are simple reasons. Fatigue, sleep deficit, or the rag. 12 එක වෙනකම් operations කළා. අයි උදේ පාන්දර 4ටත් ඇවිල්ලා operate කරනවා. You are fatigued, right? You are a normal human being. You can't do that, right? So distraction, noise, performance, pressure, right? Hospital එකෙනුත් බල කරන මෙච්චර target තියෙනවා. Right? That is why in other countries you have given working hours. ඒ hours කාලකට වැඩි කාටවත් වැඩ කරන්න බෑ. That is why it has been laid down. ඊට වඩා වැඩ කරනකොට මොකද කරන්නේ? වැඩ කරන්න පුළුවන් ඔබට වැඩ කරාට වැඩක් නැහැ 150ක ටැක්ස් යනවා. Right? එතකොට ඉබේම යන්නේ නැහැ. මොකටද ආණ්ඩුවට පණක් දෙන්න කියලා ගෙදරට වෙලා ඉන්න wife. So that is not happening in our country, right? So these are the things ඔයගොල්ලන්ට for make easier මතක තියාගන්න. HALT. This is the acronym. You can remember H for hungry, and A for angry, and L for late, and T for tired. අඩුම ගන්න ඔය තුනවත් මතක හතර මතක තියාගන්න. ඔය හතර තියෙනවා නම් don't try to perform any major duties, right? Because hungry man is an angry man, right? And then lapses, omissions. Why these omissions have happened? Simply, right, you will understand, failing to do the right thing. I make a karanna very well. Why we fail to do right things? Because short-term memory lapse. උදාහරණයක් විදිහට බලන්න තෙල් ගහන්න ගියා. right? ඉස්පිරිතාලෙන් කෝල් එකක් ආ එමර්ජන්සි එකක් කියලා. මූට දැන් මතක නැහැ මම තෙල් ගහ ඉන්නේ කියලා. වාහනේ ස්ටාර්ට් කරා ගියා. right? short term memory lapse. පේනෝනේ? අර වයර් එක කැඩිලා ඉතර වෙලා තමයි අරගෙන තියෙන්නේ. So these things trend to happen, right? ඊට පස්සේ ඔපරේෂන් එක කර කර ඉන්න ගම මාස්ක් එක ගැලුව කවුරු හරි එක්ක කතා කරලා අනිත් දාන්න. මා හිතලා කරන්නේ නැහැ. But that is the nature. ඊට පස්සේ මේක ගිහිල්ලා අල්ලගත්තා. කවුරු හරි එතකොට ලෙඩා තා මොකක් හරි කිව්වා ක්ලෑම් කරන්න අමතක. Right? So these things, these things can happen because we all humans. But that is why we should have to have double check mechanisms to prevent those things. That is why we need to have policies. That is why we need to have training. That is why we need to have supervision. Right? This is like a mantra, right? Which is happening in foreign world, which is not happening here, right? And slips and laps occurs because of these things, right? Task is very similar and requires little thoughts. For example, Peradini issue will take, right? You know, recently Peradini, one lady died who came with diarrhea. I don't know diarrhea and antibiotic care that should be questioned first, right? And then the second thing, if you have policies, so two similar tasks. What are those two similar? IV bolus and IV slow IV, right? IV bolus and slow IV, no? Right? There is no much difference. සමහර වෙලාවට ඒ කියන පුද්ගලයාට ඔය කියන nursing officer, right? දෙකම එක වගේ task එක. But there is a huge difference, right? So අරක විනාඩි 20කින් දෙන්න ඕන එක අක්ගාලා දෙකම කාලක් කරා ගැහුවා, right? So therefore these things happen. ඇයි හේතුව? We never refer to BNF, right? රටවල් වල එහෙම කරන්න බෑ. ඔයා මේක දෙනවා නම් you have to read the BNF and give, right? So there is you have to refer it, right? So two similar and familiar tasks, right? බදාව මම මේ IV දෙන එකනේ. අයිත් ඔක BNF එක බලන්න. Right? මොකද ඒ particular drug එකේ drug to drug, whether it is bolus, whether it is slow IV, වෙනස් වෙනවා. Right? Am I right in the guy? Right? So that is the thing, right? And people confuse when they are doing two similar tasks. Right? It's evidence based, right? And tasks are too complicated somehow. Right? So you are doing a KT maybe, right? So it is too complicated and long lasting. Antim mohata velakota may be exhausted, right? So then we try to do harm. And then පළවෙනි කෑල්ල හොඳට කරලා, right? And අන්තිම ටික කරන්න ගියාම, right? දැන් මට tired. So that is happening, right? In private sector, consultant is coming and doing the delivery of the baby and ask HO to do the other part. I am telling this with my experience, right? Even we did as SHOs. අපි පළවෙනි ටික කපලා HO ට කියන ඔබ මහපම් කියලා මං යනවා. Right? Don't do this, right? And steps in procedures, this is the most important thing. Steps in procedures don't follow naturally. අපි දන්නවා අපි මේක කරලා තියෙනවා. But naturally there can be deviations, right? Facts කීයක් දැම්මද? දැන් recently මේ ළඟදී date එකක් වුණා මුලතිව් වල. Why? The reason. So simply you have to get the counts, no? So that is the main procedure you have to follow before you close the surgery, right? That was not done. Patient has come after I think 1 week or something. I can remember when I was SHO, every patient who comes to the in and out wards, especially we had a checklist and we have to do VE and send the patient, right? After delivery there was some bleeding. Patient went. Beloved nurse diagnostic. With pus discharge she came, right? So there was a huge pack. So අපි VE එක කරා නම් so violating the procedure, right? Given guidelines. Simply VE එකක් කරා නම් they don't have to come. So same incident in Castle Street around 13 years back. Patient was discharged while patient is telling I am having fever, right? what was the thing? Every patient, there is a guideline, every patient before discharge, especially in the obs ward, you have to check the temperature. But simply they tick, because Castle is the first pioneered hospital to start quality and safety. They had that checklist. Before discharge, every patient, you have to simply check the temperature. And even being telling the patient what a fever they ignored. And patient died. Patient came after 1 week's time, severe sepsis, and patient died. A simple procedure, just less than 1 minute, right? And this is the thing, reduce slips and laps. You have to make aware. Slips and laps do happen, right? Don't think that will not happen. That do happen. Why? Because of distraction and interruptions. Mainly, you have to minimize, right? And then, why it is happening? Because we don't have these things. So you have to have balance with the active level and the system level, right? And then the other thing is mistakes. What is this mistakes? Mistakes, intended action is the wrong, right? අපි හිතපු එක නෙවෙයි වෙලා තියෙන්නේ. Why? Because of distraction, maybe no experience, no information. That is what has happened, right? No information, right? And applying wrong decision. හිතනවා හරි මම හැමදෙස්සෙම මොකද deviation එකක් වෙලා තියෙනවා, applying wrong decision. When we do the wrong thing, අපි දැන් මේ වැරදි දේ කරලා තියෙන්නේ හිතාගෙන හරි දේ, right? So patient ඇවිල්ලා තියෙන්නේ not for something who needs IV antibiotic, right? Never think about that, and we think never that will happen, and we have given, and right, end up with fatal error, right? So there are two things, as I said, rule based. What is this rule based mistakes? Incorrect application of rule, right? There is rule, but incorrectly you have applied. What? Wrong diagnosis. Same thing, right? Wrong diagnosis, but depend on that diagnosis you treat, right? That is rule based mistakes, right? And then knowledge based. This is the most important thing where you need the training, right? You are outdated, right? Lot of doctors in Sri Lanka are outdated. Why? Because we don't have CPD programs. After the passing out from the medical faculties, only the knowledge source is what? Majority. Medical reps, right? So we have to be shamed, right? So medical reps, right? Majority of even the nurses and everything. Sometimes if we ask, we want to do a high vaginal swab. Lot of nurses in the private sector, they don't know what are the even the instruments needed, right? How to take a wet swab, how to take a dry swab, they don't know what are the things you need, right? So that is the level, right? So we have to improve this. So the knowledge deficit and then the unfamiliar situation, right? You have to do sometimes, right? In the absence, you try to do that. Don't do, right? So you are going to do it on the outdated things. Don't do, right? This will happen. And mistakes, why mistakes happen? Because of this, right? Too many things, complex task, and the time pressure, maybe peer pressure, and these are the simple things why it tend to happen, mistakes. And the factors contribute to the mistakes. So this is typical things I am not going to explain, right? Work environment may be too hot, maybe too cold, right? When you go to some theaters, you are like in the Iceland, right? You are freezing like nothing. I don't know why. So some issues, right? So you freeze sometimes, right? And then the extreme task, high workloads, repetitive jobs, doctor hari nurse hari pay 48ක් එක දිගට වැඩ කරනවා, right? And then the social issue, ඊට අමතරව, right? හම්බෙන්න පඩිය මෙච්චරයි. නමුත් අදින්න ඕන level එකට, right? So those are the issues. Individual stresses, right? So they are maybe drug addicts, maybe family issues, as I explained my HSA, right? Then the equipment problems, කරන්න ඕනේ ඒ බඩු ටික නැහැ. දැන් මේ ළඟදී එහෙම issue එකක් ආවා, patient has been done a major surgery. So with some complications, patient readmitted. The මේ කියන equipment එක hire කරලා තියෙන්නේ, equipment එක කොළඹ නැහැ, ලංකාවටම එකක්ද දෙකක්ද මන් දන්නේ නැහැ තියෙන්නේ. ඒ equipment එක තියෙන්නේ Candival. So you can't open, right? So there is no guarantee, right? So you have to explain such things. So equipment problems. So but ultimately, as the management, you have to face this. එක්ක පටන් ගන්න කලින් කියලා තියෙන්න ඕන. So you can't do that. එතකොට ඒ මොනසය ඒක කරගන්න නැහැ මෙතනින්. Right? And then the organization issues, mainly the organizational issues are, this is the thing, training and monitoring failures. Right? Please try to think twice. And then, as I said, what are the rules? How can we reduce these mistakes? Rule based, the most important thing, you should have to have big picture. Right? If you are in a hospital, you have first, you know SWOT analysis. Everybody knows what is SWOT? SWOT. What is SWOT? S is strength, W is weakness, O is opportunity, T is threat. Please try to do a SWOT to yourself. What is my SWOT? මේක දන්නදී එක තමයි වෙලා තියෙන ලොකුම ප්‍රශ්නේ, right? SWOT කියන්නේ මම ටක් ගාලා කියන්න විනාඩියේ. My strength is my wife, right? Because she does everything. I need to everything, right? With due respect to my wife. And what is my weakness? Next door, beautiful owner, lady, right? That is my weakness, right? And what is my opportunity? When her husband is out. Okay? So then what is my threat? When I am. Okay? So please try to do your SWOT. If you know your SWOT, you can get rid of these lot of things. Right? Please try to understand. And then the knowledge-based mistakes mainly happen because of this supervision and no training and repetitive things, right? So please try to strengthen these things so you will be able to develop very fast. And then please keep your attention on violations. You can't do violations, right? You can't do violations because if you do any violations, it is a punishable offense, right? So what is violation? Nothing. What have you said? Violation, it is intentional failures, right? That is intentional failures. You have intention to do that. දැන් අරවා කරන්නේ හිතලා මතලා කරන දේවල් නෙවෙයි, unconsciously අපි හිතන්නේ නැතුව කරන දේවල්, right? So those are not punishable actually. But these are intentional failures. Deliberately doing the wrong thing, deliberately doing harm, right? That is against ethics and professionalism. So that is why you are liable to punish, right? Because we have given an oath. We don't do harm, right? That is, we have given an oath. So, violations happen when you break your rules, right? Simply, I felt I had no choice. Simply, I felt I had no choice due to situations or rules, right? Simply, Adisi surgery එකක් තියෙනවා, consultant නැහැ, SHO කරන්න, right? Simply, right? I am telling you, due to situation, වෙන option එකක් නැහැ, emergency එකක්, right? You have to do that. So I will give from my side once my wife, I had to do a ERPC, and she was just a near miss, and her uterus size was, I explained to you, it was around 9 centimeters. And my consultant, who was not doing that surgery for a long time, myself and the other, my colleague is doing, and he used the sound and put it, and he said 12. I said, sir, did you perforate? Right? When you perforate, you feel that, right? And he said no. And then he did the operation. And then continuously I am getting the calls, I have pressure Arduino. Because my wife was that time, she was teaching at the Nagata college, and head school and you want to know, the operation right? And then before, now I had a feeling, make a perforate villa, pressure Arduino. I did the scan by myself, and all peritoneal cavity is full of blood. And that time she fainted and unconscious, right? So when I take to the theater, no VOGs, right? I was the only person who was qualified to do a laparotomy. I did laparotomy on my wife, violating all the rules and regulations, thinking so that is the only intention, right? Not because love or affection to my wife, because of my children. So I know this is very unethical, so there is no option, right? So I did. Anesthetize and she was unconscious, right? If I didn't do that action, she would have died. And then, how lucky I am. When I check blood bank there is no one. So luckily, that is why I think every time if you do good things, there is someone to protect you. Allow the O negative blood pint there. So without cross matching, I gave. So at the last point, එක VOG කෙනෙක්ගේ ළමයි දෙන්නම මගේ wife ගේ ගාව ඉගෙන ගත්තා. ඒ වෙනකොටත් එක VOG කෙනෙක්ගේ wife බබා මගේ wife ගාව ඒ පන්තියේ ඉගෙන ගත්තා. Right? He was very upset. By that time when he come, I have already almost finishing the surgery. So that is why, right? Things can go wrong at any time. So therefore, please be alert. Right? ඒ වෙලාවට අර වෙන්න තියෙන දේවලුත් ඔක්කොම වෙනවා. VOG නෑ, blood bank එකේ කවුරුවකුත් නෑ. සමහරවිට සූචක මැටීරියලුත් හොයාගන්න නැති වෙනවා. Right? So please be alert. That is why you need checks and balances, right? So now, as a director, if I go to any hospital, first thing I go to the blood bank. If I caught, if someone is not there, definitely I give him a vacation of post, right? Because that is violation, right? You can't drop the blood bank and bloody hell go, right? I can remember these are the things happen. So don't do these things. You are playing with the life of someone, right? If that has happened to me, that is because I was there, I saved my wife's life. If it has happened to someone else, definitely, right? She has gone. So typical causes of violations, these are the things. The main thing, rules don't apply to them because they are consultants, right? Some people, they are afraid to tell. So make a වැරදි දෙයක් කරන්න. Please be humble, right? Please be humble. And then the time pressure. මොකද මෙතන ලිට්ටු ටික බලලා අතෙන්ටත් යන්න ඕනේ. එතනින් තව තැනකට දුවන්න. So time pressure, right? This is the reality I am telling, right? Nurses ලටත් එහෙමයි. දැන් මේක off වෙලා ගෙදර දුවලා ඉවර වෙලා උයන්න ඕන. මොකද ඒගොල්ලෝගේ ඇත්තම life එක පටන් ගන්න work life එක පටන් ගන්න එතන. Right? හැමෝටම මේක පොදුයි, right? So time pressure. Then the most important thing, understaff. Right? These are the things where typically violations tend to happen, right? And routine violations, as I said, non-compliance. So please try to comply and then complain, right? Without complying, don't try to complain. You first complain, say this is not suitable for our system, shall we change? But without complying, don't try to complain, right? So rules no longer apply, right? rules තියෙනවා. අපේ රටේ වගේ right. ඔක්කොම rules තියෙනවා right. වෙන කොහෙවත් රටක අපේ රටේ තරම් rules නැහැ. But that doesn't apply. No longer valid. Right? Surgery. While surgery, not wearing a cap, that has become mama consultant mama දාන්නේ mask එක. Oh, he has having a God given priority. Yeah, having the full step. Right? No germs. I am not wearing. Right? And then pre-operative checklist. If I ask a question, can you answer genuinely? Before the surgery, do you use the WHO checklist? Major and the minor? Using. And then taking off safety goggles to improve the visibility, right? So simple violation, right? And then hand washing, not doing, right? Not properly. Recently I got a complaint, one of the consultant, BOG, he's entering to the theater without changing. Everybody is not there to tell that, right? They are afraid. And I was also embarrassed because he is my classmate. So I called him, Majang, don't do this. If you do this, I have to take some action. Right? That time I was the RD. Right? So these are the things, right? So you should not violate, right? මොකද එහෙම යන්නේ හවසට ටක් දාලා එක PPA එක ඉඳගෙන දුවගෙන යනවා ඇඳුම් මාරු කරන්න වෙලාවක් නැහැ. එක්ක අඩුම ගන්න ගවුම් එකක් ගන්න එහෙමත් නැහැ. Right? Going inside. So that is terrible, right? And then handoff. Do you know what is handoff? I don't think. Even you have heard the word. Handing over and taking over. That word is not used any longer in the world. Use handoff. Right? So do you use that? Do you have any books? On what basis you do the handoff? Any tool? S-bar tool, you know? Some tool. What is S-bar? This is mainly using in USA, using in UK, using in Singapore. What is this S1? S is situation, B is background, A is assessment, R is recommendations. So only these 4 topics they assess any patient and they hand it over to the next shift, right? So please try to do this simple thing, right? Simple thing. So please adhere. You can minimize lot of things. That in particular case, if the background asks any allergy, you will never do this, right? So please try to understand, right? And the other thing, ward rounds. So don't do ward rounds on same time. First thing you have to do the ward rounds, especially for the managers. I am telling, not for the consultants. Especially management. Don't do ward rounds on the same time. Don't do on the same ward, right? When I am doing, sometimes I go at 3 o'clock, right? Then only you can stop those who are on alcohol, right? Right? So you have to go on different times and the different places. When you go, you have to go with someone else for the proof, right? Evidence. So please do this. Ward rounds is very important, right? That is you call management by walking, right? Though it is all good theory, now you don't have to walk to manage. There are internet and CCTVs, but still it is work, right? So now the theory is management by networking, right? Not the management by walking, right? So situational violations happen with non-compliance because, as I told, situation specific factors, the first thing, and then the other thing, non-compliance. So very good example, untrained. So because of the situation, you allow untrained professional to do a major surgery. Yeah, that no, but he doesn't know the theory, right? He dakala karanda puluwan, but he has never done this, right? So that is violation. And anithe හොඳටම දැකලා ඉතින් අපිට දැන් මේ දවස්වල පාරේ යන්න බෑනේ මේ Uber drivers ලත් එක්ක හැවෙන් දානවා මෙහෙන් දානවා. Why? Because the time pressure. Right? They speed. මොකද ඒගොල්ලන්ට delivery එක ගන්න තමයි සල්ලි හම්බ වෙන්නේ. So these are violations we have to come up with. මුන්ට දෙන්න පුළුවන් දවසකට හරි පැය ගානකට හරි මෙච්චරයි. Because මේ rules නැති හින්දා the others the normal public is embarrassed. Right? Then the other thing is exceptional violations. These things there is no way, right? You can't do these things, right? Attempt to solve a problem in highly unusual circumstances. එකක් කවදාකවත් කරලා නැහැ, but you try to settle it. Often if something has gone wrong, දැන් ඇත්තටම වැරද්දකුත් වෙලා තියෙන්නේ, right? Still you try to make වහගන්න. ඒක තමයි වෙලා තියෙන්නේ, right? Don't do that. The very good example I will tell recently, around now 3 months back, in one of the major hospital there was a maternal death, right? There was a maternal death. So there is something called retrospective writing. You people don't know? වැඩේ කරලා ඉවර වෙලා තමයි write කරන්නේ. There's a retrospective note that is legally accepted and valid. What has happened in this particular hospital, patient has died. This is a maternal death, right? Serious incident. What has happened, these poor people සම්පූර්ණ BHT එකම ඉරුවා, right? ඉස්සෙල්ලා කරේ මොකද්ද? මුළු BHT එකම rewrite කරා. මොලේ පොඩ්ඩක් කල්පනා කරා, පෑන් කීපයකුත් පාවිච්චි කරා. එකේ කළු පෑනෙන් ලිව්වා, නිල් පෑනෙන් ලිව්වා, නිල් පෑනක් දැන් පෑන් තියනවා නම් මෙයාගේ පෑනක් ඉල්ලගෙන දිනනවා, ડોක්ටර්ගේ පෑනක් ඉල්ලගෙන යනවා. but පෑනුත් වෙනස් කරලා now they have rewrite the whole BHT, right? What has happened, this world is now, that is why I said we are living in a VUCA world, right? මේගොල්ලෝ complaint එක දැම්මා, ටිකට් එක යවුවා රස පරීක්ෂක. රස පරීක්ෂක වාර්තාව දුන්නා. පැය දෙකක් ඇතුළත තමයි hand writing තියෙන්නේ මුළු BHT. Right? So that is why I am telling exceptional violation don't do. So simply අරකෙදී retrospective note එකක් ලිව්වනම් ඉවරයි, අර ටිකට් එක වෙනස් කරන්න නැතුව. Right? Don't do. වැරද්දක් කරලා ඒ වැරද්ද වහන්න තවත් ඊට වඩා ලොකු වැරද්දක් කරන්න යන්න එපා. Right? So takes the calculated risk in breaking rules, right? දැන් මෙහෙ තියෙන මේක සම්පූර්ණම වැරදිනේ BHT එක වෙනස් කරන එක. රිස්ක් එකක් අරගෙන මේක වෙනස් කරනවා. ටීම් එකක් විදියට. අන්තිමට මොකක්ද කියන්නේ? මම නම් දන්නේ නැහැ. මෙන්න මේ සර් තමයි කිව්වේ. මේ සර් කියපු හින්දා තමයි මම සම්පූර්ණ BHT එක වෙනස් කරේ. right? සමහරලාට මේ මිනිස්සු මුලින් ඉඳන්ම BHT එක මේ වෙනකොට ස්කෑන් කරගෙනත් ඇති, ෆොටෝ ගහගෙනත් ඇති, right? එහෙම නැත්නම් අපේ එකෙක්ට දුන්නාම මයිනස් ස්ටාෆ් එකෙක්ට ඌ ෆොටෝ එක ගහලා දෙනවා රුපියල් 500ක් දුන්නාම ඕක. right? So therefore don't do that, right? And the other things, lot of private hospital I have seen, you don't have mentioned in your BHTs, this is a confidential document, please do that, right? In the next printing. So BHT is a confidential document. So you will get some kind of legal validity. They can't do photocopy and things, right? So that is a confidential document which is not in most of the hospital documents, it is not there. I don't know in your hospital, if it is not, please print it, right? And example is this, you had a puncture, right? You had a puncture. දැන් මට මෙතන 11ට එන්න ඕන ලෙක්චර් එකට. එන්න විනාඩි 20ක් යනවා. පංචර් එකක් තියෙනවා කියලා දාන්න. දැන් normal speed එකේ ආවොත් එන්න බෑ, විනාඩි 20 යනවා පරක්කු වෙනවා. So what you do, අර normal speed එකටත් වඩා වැඩියෙන් එන්න හදනවා, even you are knowing your tire is flat. So this is exceptional violations. Don't do that, right? කාර් එක පැත්තකින් තියලා කෝල් එකක් දෙන්න මම විනාඩි 15ක් පරක්කු වෙනවා, මට flat tire, I have to hire a vehicle and come. Don't take risk, right? So please try to understand, don't do, never do exceptional violation. No violation at all, but don't do exceptional violation, you are at a risk, right? So to reduce violations, the most important thing, as I said, mantra again, monitoring supervision. This is the no cost, low cost thing, right? Simply monitoring supervision, you don't have to check everything, right? Simply you just have to, and samara velawata when I was RD, right? Mama seat එකේ නැත්තම් මුන් ඉන්නවා. Hospital වල හැමෝම ඉන්නවා. Right? When I was the director at Illinois, sometimes I am at Colombo, but I send my vehicle to go around and come. Right? So these are the things. You have to simply monitor and supervise. Right? Because මේකට හේතුව අපේ රටේ මිනිස්සුන්ගේ attitude. මේක අනිත් රටවල් වල නැහැ. නැහැ කියන්න බෑ. Because hospital එකට ගියපු වෙලාව hospital එකේ හිටපු වෙලාව දන්න මොකද ඔයාලට මේ දොරෙන් ඇතුල් වෙන්න බෑ sweep කරන්න නැතුව, right? එළියට යන්න බෑ. So it is monitored naturally, right? So people don't do that, right? ආවරම් පැය 6 ඉඳලා තමයි ඇතුළට එළියට යන්නේ. අපේ රටේ එහෙම checks and balances නැහැ. ඒ මිනිස්සු අපිට වඩා හොඳයි කියන එක නෙමෙයි. They have been, because of that rules and regulations, they have been trained to do that. ඒගොල්ලෝ ඒක violate කරන්න කැමති නැහැ. Right? And then the වැරද්දක් කරලා reasons උත් අපි සමහරලාට දෙන්න යනවා. Right? And then participatory approach. You know what is this participatory approach? ඒක තමයි අපිට ගොඩක් වෙලාවට නැත්තේ. If something has happened, we don't have participatory approach. කවුරු හරි දන්නවා මොකද්ද මේ participatory approach කියන්නේ?
Discuss with them.
There is a very
You discuss with them.
not discuss. You have to go to the gemba kaisi. So you have to do gembetsu. You have to go to the scene and be living with them. Try to understand what is the problem. මේකට හොඳම case study එක තමයි. There is a very good case study from USA saying my car does not like vanilla ice cream. වෙලාව කියනවා නම් I will explain. My car does not like vanilla ice cream. If you want you can read, or if you want I can take 5 minutes another from your time I will explain. Order. Okay, what is this participatory approach mean? One person he bought a new car, and every time their tradition was to, after the dinner they used to go for the ice cream, right? So every time he goes to the ice cream seller, if he takes vanilla ice cream, car doesn't start. But if he go to the chocolate or some fruit and nuts or something, no problem. So he wrote to the company, my car does not like vanilla ice cream, right? So the company policy was to comply to any complaint, but they ignore this. What a lunatic this one, right? And they didn't respond. But that is violation again. And again after 2 weeks time, he again wrote. So reminder. Still I would say, my car does not like vanilla ice cream. Right? Then only they understood there is something. Right? Then they thought to have a participatory approach. What is this participatory approach? They assigned a senior consultant, senior engineer to go and have. So he thought he is a wise man. He thought to go to the scene. He went to the place, he discussed and went. And he had dinner with this particular place. And then they went to the ice cream with the family. And as he said, after vanilla ice cream, car does not start. You have to wait for some time to start. Right? And then next day night, again he went. They took chocolate, no problem, start. Again maybe some ice cream, start. And again he went for the vanilla, no start. Right? Then he is a wise man, I said. So there is in management, there is time series analysis. Again that is. So he did the time series analysis and process mapping. Right? He analyzed everything and he mapped the process. And what has happened in this country, vanilla is the most favorite, right? So because this is at the front desk, right? If you go to chocolate and these things, that is not much popular. That is at the back end. So he analyzed the process. How many time you get to get this ice cream, 2 types of ice cream. Because there is a pressure valve, right? In this particular vehicle that time, the pressure valves come to 0, it takes 5 minutes. So when you go to take the vanilla, You come within 2 minutes, 3 minutes, maybe 4 minutes, car doesn't start because the pressure valve hasn't come to the zero. And wherever you go to chocolate, it will take more than 5 minutes. So the pressure valve has come to zero, you just start and come. So this is you call participatory approach. Understood? Right? And then the most important thing, working environment, you have to adhere simple low cost, no cost 5S. Right? Dust, fumes, heat, those things. 5S please adhere. And unnecessary equipment, if you adhere to 5S, unnecessary will go off. And please start from today itself at least reporting culture. If any incident, so that is in UK you call great X, you can, so simple thing, whether it is a wrong thing, maybe it is a right thing, ask them to report. Right? Appreciate, මාසෙකට පාරක් තියලා පොඩි certificate එකක්. So nothing else. In front of everyone appreciate it. So that will work, right? And then training. Please try to do this. And please try to see this. This is the most important thing. To error is human, as I said, but violation is not. Right? Please try to understand. Error is human, but violation is not. Right? So please try to have a small look. This one, I am finishing within next. Something. I don't know why he knows something. On something you can understand this. He is tired, right? He has not taken required measures after stopping the vehicle. So please try to have small breaks, refresher, even after between 2 surgeries maybe, right? Take small time, right? Try to have some debriefing. Right? Try to have some refresher. So, lot of things you can minimize. That time is worth, right? Maybe thinking that time is not worth. No, that is much worth, right? Please try to do that. And simple example to understand these things, adverse event, and how this is occurring. This is a cascade reaction, right? So, if something happened, the other will happen. The adverse event, nearly unintended administration of potassium chloride, right? You want to give sodium chloride and instead you have given KCl, what will happen, right? So, what is the active failure there? The nurse committed a slip. She took KCl vial while intending to administration sodium chloride. Sodium chloride තමයි දෙන්න ඕන. නමුත් වැරදිලා KCl bottle එක තමයි අරන් තියෙන්නේ. ඇයි කියනම පල්ලෙහාට කියන්නේ. Right? You know what will happen given NaCl and KCl, right? And then the other thing, the physician has prescribed the drug using chemical formula. He has written KCl. NaCl සමහරලාට ඔක ලිව්වහම වැරදිලා KCl කියලා පේන්නත් පුළුවන්. අයි තාන්නත් බයයි, right? Right? So think what is the difference? And latent failures what? Because two wires have been exactly the same shape and dimension. Right? මේ වගේ. එකට දිනුනොත්, right? So what will happen? Right? So same shape හදිසියට දෙනවා නම් sodium chloride එකයි KCl එකයි දෙකම එක වගේ නම්. So this can happen, right? And then the labels are quite similar. දැක්කනේ එකම පාටට තියෙන්නේ. අර ඉස්සෙල්ලා කරපු ටෙස්ට් එක මතකයිනේ. So you tend to do harm. And then two drugs they are in the same shelf. ඒක මොනම නිසාවත් මේ වගේ high risk drug එකක් normal drug එකක් එක්ක එකම shelf එකේ තියන්න එපා. Right? ඊළඟදී if it is a high risk drugs always two locking mechanisms, right? යතුරු දෙකක් තියාගන්න. එක යතුරක් sister ගාව අනිත් යතුර ඒ වෙලාවේ in charge ගාව. එතකොට දෙන්නත් එක්කම එකතු වෙලා වගේ දෙන්න. අරින්න ඕනේ. checklist එකක් තියන්න. And then the setting was why this is happening. The setting of a ED is high volume. රටක් ගාලා මේ වැඩේ වෙන්න ඕන. බල බල ඉන්න වෙලාවක් නැහැ, right? ආපු ගමන් දෙන්න ඕන. And then no procedure. ඒකේ checklist කරනවා මෙයා මොකුත් නැහැ, right? So this can happen. මොකක්ද එතකොට කරන්න ඕන? Procedure put in place for double check, right? ඊළඟ වැදගත්ම දේ දැන් මේ bottle එක, right? Substitution of high concentration KCl valve with the dilution. ඒක dilution එකක් එක පැකට් එකේ එකට ආවනම් අනිවාර්යයෙන්ම තේරෙනවා මේක dilute කරලා දෙන්න ඕන කියලා, right? දැන් මේක මේ විදිහට එන්නේ නැතුව dilution එකයි KCl එකයි එකම පැක් එකේ කඩලා ආවනම් ඕනම conscious මනුස්සයෙක්ට තේරෙනවා there is something you have to dilute, right? Please try to take these measures if you don't have these measures in your hospital, right? And this is the all about I have spoken up to now. So these are the things what will happen. Latent failures, so the managerial issues, there is no checks and balances and the monitoring and supervision, training and things. So what will happen with the work conditions, heavy workloads and the things, this is the background for the active failure. So you will do all these errors, mistakes and the violations. So what will happen, even though these things happen, if you have a defense mechanism, so something checking before going to give in, right, rechecking and to put the ticks and asking and some visual bandings or something, DHT එක වෙන පාටක් මොනවා හරි එහෙම තියෙනවනම් you will never do this because there are defensive mechanisms layout, so then this will not happen, right? And then the errors, medical errors, very few slides. Errors can occur at any point. Please, all the consultants, all the doctors, all the healthcare workers, please remind this. This can happen at any time. You don't know when it is. So therefore, you have to be alert anytime, because the most important thing what is happening is the prescription errors. Why wrong prescription may be? Because you can't sometimes read. හිතලා තමයි අපි drug එක හිතන්නේ. Whether I consultant කතා කරන්නත් බෑ, handwriting is very poor in majority, right? I would say more than 80% handwriting. And then කොහොම කියවනවද කියලා එක අහන්න pharmacist කෙනෙක්ම වෙන්න ඕනේ, right? මම හිතන්නේ හොර pharmacist ලාට තමයි හොඳටම කියවන්න පුළුවන්. Because they have matured enough, then this handwriting issue. And then what is the most important thing always we miss and which is not missed in the foreign countries, allergy. That is their mantra, right? They will never start getting admitted without asking that, right? So therefore allergy band, that you can use a reusable band, right? Band 100ක් ගන්න, band 10ක් ගන්න. හැමෝම allergy නෑ, allergy එකට එක්කෙනාට ඒක දාන්න, right? රතු පාට band එකක් අරකට ගලව ගන්න, right? And ask him to not to remove it. If you remove, that is your baby, right? That should be in your SOP. මේක ගැලවුවොත් අපි ධර්මයට පස්සේ discharge වෙනකම් that is your responsibility, right? Please keep those things, right? So it can happen drug to drug and drug to diet, right? And wrong administration, please try to have, there are 6 W's. What are these 6 W's? So these things can happen. You can prescribe wrong drug, right? You can give the wrong route, right? You have to give IV, bolus, you have to give slow IV, you have given bolus, right? So maybe you have to give it IM, you have given it IV, right? And then the wrong site, right? And then the wrong frequency or the rate. And then the most important thing is wrong patient sometimes. And then the wrong dose, right? So please be alert, these 6 W's, right? අපි හිතන්නේ නමුත් this can be happen and leads to adverse events, right? And to prevent this, the most important thing is SBAR. Most important tool is SBAR because everything is embedded. They are very time tested, very easy, right? I don't know why not adhering. That is very time tested and very easy one. And then they improve in handwriting, right? Especially at least in the private sector. And then the avoid abbreviations which is not accepted, right? Which is not accepted unless it is internationally accepted abbreviations, right? Please try as far as possible, try to minimize the abbreviations, right? Because as a administrator මට මගේ සමහර විට මම දන්න abbreviation එක as a clinician may be different. I will think වෙන විදියකට, you will think some other way. So therefore don't use the abbreviations. Then be aware of similar drugs name. This is the other thing, right? This is what has went wrong in the Peradeniya incident. And then the double check. Always double check. And you know what is this? LSA? Yes, nurses nonsense. Looks alike, sounds alike. Right? Latent sodium, diclofenac sodium. Right? So looks alike I showed, right? This one. This is like looks alike and then sounds alike. And then try to minimize the distraction. If you can do these things, you can do a good job, right? Still you can't. Can you avoid any harm? No. Right? You can mitigate. We can't avoid harm, right? Right? In anywhere in the world, you can't avoid, but you can mitigate, right? Even if you adhere to the Six Sigma, there is chance. So in the particular case, I would say patient identification. If the patient identification done properly, right? So you people asked to go out to the patients, like the relatives, right? If they were there, you would have to ask from them. Hi, is the patient is maybe patient is unconscious, right? Right? Maybe patient is not alert, right? So then there is something, right? Evidence. You would have to ask every time from these incidents, right? Ask always. There are three things at least you have to ask: name, the BHT number, and at least age, right? At least always try to use three things, three factors. Then the studies shows 99% 99 is correct, right? And then the recheck with always the BHT, and please, I don't know it has been checked or not, right? And visual control, always try to have visual controls, different colors of BHT, wristband and something, right? And further, the most important thing is communication, which has not happened from the beginning, right? Even the allergy is written in green pen, using a green pen. No importance given, that is, so you are getting an allergy patient to a particular drug, like this, something like this basic drug is very rare, right? Am I right? Very rare. So that is one of the most important thing in this BHT, which is missing, which is not given the priority. If you have given the priority, so no issue, right? This will never happen, right? And then the communication, which has not been happened from shift to shift. You have to have proper handoff, right? Which has not happened, which should be right in writing, right? Especially in the private sector, please write. Then you can use this as a proof, right? When we have a shift handoff, we have evidence, right? But that is not. And then the observations, right? Or the back can write something, right? So you have to observe. So don't let, especially without
some superior, don't let a junior person to do these things, right? So please try to adhere these things so that you will be safe, right? And then the other thing is surgical errors. Surgical errors happen because of the negligence. I said what is negligence? That is below the professional standards. And these are never events, right? In medicine it calls never event, it should not happen, right? At any cost it should not happen. And doing a wrong surgery on wrong side, can it be happen in this world, right? With all these gadgetics and everything, this can't be happen. That is why we call it is a never event. And but still it is happened. Retained sponge and instrument inside is still, right. I said recently, right, there was a pack inside the mother and death, right. So these things can't be happen, right. That is why we need to have checklist, and then we don't adhere to the well-known universal protocols, right. Please try to obey, because of that is our survival. If we violate any laid down these rules, definitely you have to pay from your life, right. So those two incidents, right, this train incidents, lifetime imprisonment, right. So no, your life, your entire career is finished, right. Sometimes what you have earned entire life you have to spend for the court cases, or sometimes you have to settle with them, right. So entire thing, right. So recently my son met with an accident, and නඩුවට ගියාම කිය සර්ලාට සල්ලි තියෙනවනේ, සර්ලා ගෙදර වාහන මෙච්චර තියෙනවා, right, සර්ගේ ගෙදර මේ වගේ. So they will decide in a simple thing with your name, right. ඒගොල්ලෝ ගාණ තීරණය කරන්නේ අර ඇක්සිඩන්ට් එක අනුව නෙවෙයි, with your image, right. Therefore especially, so the top class consultants, be careful, right, because this is professional jealousiness, right, nothing else. And then these are the other things which can happen in our settings: diagnostic errors, wrong diagnosis, and the patient machine interface. Don't rely on AI, right, especially in medicine. You can use AI, but don't rely, because machines can go wrong at any time. If human beings doing errors, why not the computers, right? And then transition and handoffs, which is not happening correctly, and then no teamwork. I have a very good what do you call, video for the teamwork. If time permits, I will show you, right? But sounds නැතුවනම් බලලා නැහැ. And then the communication errors. So huge communication gap because of the එක එක category අතර තියෙන ප්‍රශ්න නිසා. Huge communication, no respect each other. Sometimes I don't know how it is in the private sector. So this is the main thing, right? You are a team. So without anyone you can't do this. Even the janitor, you can't do this job. You have to give the respect equally. You have to maintain equity and equality, right? And then the hospital acquired infection, which can give massive issues, and then the other like pressure ulcers, falls, especially if you don't have mechanisms to identify falls, please develop bans. So that is the next issue always coming in UK, right? So that is the main litigation, right? And then the thrombosis, right? Thromboembolisms. So these are the main things you have to keep on attention, right? Why these things happen? So in this particular case, the patient we don't think that we have to give IV antibiotics, because this is something totally different. Never we will think අපිට antibiotic එකක් දෙන්න ඕන වෙන case එකක් කියලා හිතන්න, right? This is you call in modern management monkey illusion, right? You call this what? Monkey illusion. Please try to have a look, right? This is called monkey illusion. Please try to have a look of this one. So see, and I will ask some questions, right? And then I make a subject here. The subject is not huh? You know subject? No subject. Subject is you can't understand for till that. So to promote the safe culture, right? You should have to have safe culture here embedded, right? You should have to have reviews. If there is a minor injury or a major incident, please review it, right? Please criticize each other, right? In closed doors, right? So try to develop understanding the root cause and try to take measures. But don't finger each other. No. These things happen because of a reason. You have to find out the reason. Unless you treat the reason, these things can recur, right? If you don't stop the root cause, this will come again and again. Make a hurry at බෝලයක් වතුරේ ඔබාගෙන ඉන්නවා වගේ තමයි. බෝලේ ඔබාගෙන හිටියට වැඩක් නැහැ. Right? හරියට reason එක දන්නේ නැතුව it will come up again. Right? Then the communication, develop a very good communication tool like SBA or something. And then the medication use, especially if you are using high risk drugs, always be very careful, right? And then the work life and workforce, ergonomics, please adhere to ergonomics. Theatre එක සද්ද වැඩි නම්, theatre එක හීතල වැඩි නම්, theatre එක අවශ්‍ය instrument නැත්නම් surgeon ට තරහ යන්න පුළුවන්, right? ඊට පස්සේ මුළු surgery එකම කරන්න තරහයි. Right? So this is happening, right? Because we all human beings, right? And then the infection control, that is the most important. Always analyze, always do measures on the infection control. And then you have to do on your risk assessment, at what level your risk, right? So there are a lot of tools to do this risk assessment. So for your easiness, if you can adhere, I am safe. If you are on medications, if you feel sleep, don't come. If you are under stress, please get the excuses. If you are on alcohol, never come, right? If you are fatigued and emotionally not stable, don't come, right? Please try to, I am safe. So then you will be able to minimize these things. Hi. So now see this procedure. This is total violation, right? So now he is using the key. Again violation, right?
Bluetooth mode.
It is metal, right?
The monkey business illusion.
Please have a good look.
Count how many times the players wearing white pass the ball.
Please count. Okay, how many counts? Huh?
60. 16.
Very good. 16, very good. So you have to concentrate on white people. And what has happened further? Any changes did you notice?
Yes, I'm left.
Huh? Another වෙනස් වෙච්ච දේවල්.
One black person left.
Yeah, very good. What else? How that a black person went? The monkey went goose off. Okay, see how you have missed. Because why? Because now you have concentrate on white ball passing on. So this has happened in particular this incident also. You have concentrate on the one thing. So you will miss other most important many things. Right? That has happened, right? So here now didn't you notice this curtain has color has changed? Who noticed that? This was red and turned into gold. Who noticed that? Nobody. So that is what this is you call monkey illusion. Again listen to this. Sorry. Again have
The monkey business illusion. Count how many times the players wearing white pass the ball.
See how color is changing. Now the black man is going, can you see? But first time nobody noticed that, right? And now see the color has changed right into golden.
Answer is 16 passes. Did you spot the gorilla? People who haven't seen or heard about a video like this before, about half missed the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. Here comes the gorilla, and there goes a player, and the curtain is changing from red to gold. Looking for a gorilla, you often miss other unexpected events. That's the monkey business illusion.
So please, so this is what is happening in this world, right? We concentrate on one thing, so we miss important many other things. So always keep that in mind. So that is why I am telling this is we all human beings, right? So this is the reason. This is you call intentional blindness. Focusing attention on something else, right? අපිට කිව්වා බලන්න කියලා බෝලේ පාස් කරන එක බෝලේ පාස් කරන එක විතරයි. So that is normal human being. So that is why these things happen. Right? It says there is the rate of medical errors is stunningly high. So that is the reason for my disturbance. So that can't happen, no? But that is why, right? So this is my last video. To prevent this,
Human and organizational performance. As human and organizational performance practitioners, we recognize that humans are fallible by nature. As a result, we often not only hurt ourselves, but also tend to inadvertently hurt others, damage things of value, and have a large variety of other missteps. Even though most managers recognize their own fallibility, they often see the errors made by their workforce to be a choice. In fact, in most Western societies, leaders of organizations often believe that if a person makes a consequential error, that person has a character flaw and may even be a bad person. This type of thinking often creates a culture of mistrust and underreporting of near misses and events. Unfortunately, many organizations spend little to no time educating their organizations about the fundamentals of human and organizational performance and human error. This leads many organizations to continue to assign blame to the workers who erred when an event has occurred that damaged an organizational asset. Assets can include people, equipment, the facility, the environment, and often the organization's reputation. Unfortunately, many organizations also use the number of errors as a measure of undesirable performance. and set ridiculous goals such as 0 errors, which is never practical or sustainable. Over time, this has proven to be a futile endeavor that does not have the desired result of reducing neither the severity nor frequency of the undesirable events an organization will experience. Our simple definition of human error is the behavior that unintentionally deviates from the preferred behavior for a given situation.
So please rethink, right? You have to develop a culture. And for that,
Human and organizational
I would
performance.
say, if you have time, especially our leaders, so please read on this book, very good book, Error is Human. This is a very old book, but still worth reading, right? And then the most important thing, please treat your patient as a king, not as another king, right? But we are treating as another king most of the time. Don't treat them as another king, try to treat them as king, right? So thank you very much for your attention. So we can tell things, right, as Lord Buddha. So we can invite, so you have to start the journey. So thank you very much for your patient listening. So hope for the best. Thank you very much. Meeting, if you want to ask, you can. Right? Otherwise, we'll find out.
What is retrospective notes?
Retrospective not mean, right, in any emergency, you can't write while doing or while managing that particular incident. So you, like particular incident will say, this particular case you have to manage the patient vigorously, right? So you don't have right to write notes, right? So you can manage the case, right? You can manage the case. Maybe it will take 30 minutes, maybe 2 hours, no worries. But then you write on the top, retrospective note. You can write it, right? You have to write retrospective note. Underline this and then write. Type, probable time, right? Maybe 7 o'clock, we identified patient is developed severe anaphylaxis, right? We started giving adrenaline on this time. And this time we start CPR. So procedures, like this is not the exact time, but the most probable time you have to write, and then all the people who have managed the case sign, right? If possible, if in the private sector, because this is a teamwork, may make a manage ka, right? Write it. So that is you call retrospective note. But you don't have to write BHT manage kara. That you can't do, right? Because the most important is to manage the patient, which is why this has happened adapted in foreign countries. They treat the BHT, not the patient, right? BHT enter karanna to a patient touch kara. So don't do that. That is not practicing in Sri Lanka. You can manage the patient very well, and then after you write the BHT. Always the make a prashna BHT wala ogollo number in that. Always try to put the numbers in the BHT, right? Ticket එක 2 3 4 අලුතෙන් කොලයක් පටන් ගන්නවා නම් ඉන්න ස්ටාෆ් නර්ස් ගේ ජොබ් එක තමයි මේ ටිකට් වල නම්බර්ස් දාලා තියෙනවා. මොකද ටිකට් එක කඩන්න පුළුවන්. අලුත් ටිකට් එකක් දාන්න පුළුවන්. පුළුවන් නම් ඒ ඉන්න ඒ වෙලාවේ ඉන්න යුනිට් ඉන්චාර්ජ් ගේ පොඩි සිග්නේචර් එකක් දාන්න. Right? I will tell you one particular incident recently. Top person in the ministry is telling Dilip මාර වැඩේ මේ වෙලා තියෙන්නේ අපි PSC එකට යවපු මැද කොලේ ගලවලා. මම ඇහුවා ඒ සර්. So you have my signature එකක් දාන්න. My practice. If I am sending 100 will say some document මම හැම එකේම යට මගේ signature එකක් දාන්න. දාලා පොඩි seal එකකුත් දැම්ම මම හදන්නේ. Sometimes if I can't do that, I will ask my assistant to put the signature. So, දැන් අද තියෙන world එකේ you can change the මැද කොලේ ගලවලා වෙන කොලයක් something not relevant to that. So that has happened, right, in this particular incident. This is a legal case. So මැද කොලේ ගලවලා වෙන කොලයක් දාලා. මොකද ලංකාවේ minus staff මිනිස්සෙක්ට රුපියල් 500ක් දුන්නොත් ඕන දෙයක් කරන්න පුළුවන්, right? That has happened. මැදකොලේ මාරු වෙලා තමයි PSC එකට ගිහින්. So that is why always try to take precaution. මොකද මේවා ගත්තා කියලා ලොකු හානියක් වෙන්නේ නැහැ, right? People will understand why this rules and procedures there, right? Once if you hit with the case, then only you will understand මේක වැදගත්. හොඳට ලස්සනට අකුරු ලියන්න ඕන, වෙලාව හරියට දාන්න ඕන, අස්සන දාන්න ඕන කියන දේ තේරෙන්නේ once අපිට මේ ප්‍රශ්නේ වුණාම. නැත්තම් අපි හිතන් ඉන්නේ මට වුන්නේ නැහනේ, අරුන්ට තමයි වෙලා තියෙන ප්‍රශ්නයක් නැහැ. So that is not the case, right? So please try to do something. So for this you have to have good teamwork.
And systems.
Yeah, definitely you have to develop systems. Without systems you can't do. If you can adhere to these things, these මේවා ඇත්තටම සල්ලියන දේවල් නෙවෙයි. හරි simple පොඩි දේවල්. ඔයගොල්ලන්ට මේවට ඇත්තටම adhere වෙන්න පුළුවන් නම් මට හොයාගන්න පුළුවන් නම් මම පෙන්නන්නම්. මම අර කිව්ව team work එක
Can I invite?
Dr. Dilip, I remind Dr. Liyanage, he's in the
Yeah, yes, I know.
Yes, we'll ask him to give the
Yes,
vote
yes.
of thanks.
Anyway, on behalf of the hospital, I would like to thank Dr. Dilip Liyanage for that excellent eye-opening lecture. I think probably for 2.5 hours.
Yes.
I don't think anyone felt that it was that long because it's so in detail, so simple to understand, and I don't think for a long time we had a lecture like this. So thank you very much, Dr. Dilip, for that. Excellent. I think you would have spent hours and hours preparing this. So we appreciate your effort, and we appreciate what you are doing in the PHRC, trying to improve the system. So on behalf of the hospital, I would once again thank you, and we probably will invite you for several more lectures of this sort of try to improve our services in this hospital. So thank you very much once again. We really appreciate your lecture and what you have spoken to us, and I hope our administrative team will try to implement a lot of things. We have already done something, but we will try to improve with your help to make this hospital a model hospital for the rest of the private sector. Thank you very much. Thank you.
Okay, then finish now.
I can't find that.
medication incident